Hi everyone, I'm Dr. Kristin Rushing with the Nashville Smile team. Today I wanted to talk with you about communication tools to use with your dentist if you're about to complete a smile makeover or if you're looking to enhance your smile. The reason that I thought of doing this video is I recently had a patient that had a smile makeover done some years ago, probably 10 or so years ago, and she had a crown on her very front tooth break. She came in and was, she was worked in as an emergency patient, and we were focused on, okay, let's get you presentable, and then we'll work out exactly what you want to do to fix everything. We knew we were looking at replacing at least one of her crowns. One of the things that we were discussing just through the appointment, she actually said that, she was really disappointed in her crowns whenever she had had them made previously. And whenever I asked her about that, she said they were just so different from her natural teeth. She was really quite shocked whenever she got them, and just the shape really wasn't quite what she was looking for. And so after some discussion, and because it had been so long, she decided that she wanted to redo all of her front crowns. That would give her the opportunity to whiten, but then also it would give us the opportunity to change the shape to something that she felt matched her better. And since obviously I had not known her 10 years ago, I asked, well, what are you looking for? And she said, well, I don't know how to say this. This is something that's very hard for me. And she even joked that I don't even know what to tell my hairdresser whenever I have my hair cut. And that's probably something a lot of people can relate to. And I get it. Dentists, we speak sometimes in a different language. So it's hard to find the right tools of communication. So I asked her, about the length, about the shape, about the size and the proportions. And what we worked out was I sent her a series of pictures, and I said, look at these and tell me what you like about them and tell me what you don't like about them, because that all gives me information on what you're looking for in the end result. And through that communication, and she also sent pictures of her whenever she was younger. She sent pictures of her mother. And for her, since it was such a drastic change from what she had initially to the crowns that she had now, I asked, are you wanting to go back to what you had before? Because that may be a rather dramatic change now, and is that something you want? And what she ended up deciding on was something in the middle. She wanted to soften the features of her teeth, she wanted to whiten them, and she wanted to change the proportions so that they were a little bit more symmetrical and a little bit more even. And without that communication, I wouldn't have known what direction I needed to go in. And with her, what we did, since she had decided that she was going to replace those crowns, I ended up reshaping those crowns so that she could get a preview of what we could make the permanence in. And after she was happy with the reshaping of her crowns, that's when we said, okay, this is what we're going to mimic your new crowns after. So I'd like to walk you through that, as well as some other communication tools that can be helpful whenever you're going through a smile makeover now. All right. So here is my patient with her broken tooth. Obviously that's not pretty, but her crowns are not bad. They look quite nice. For her, they were a lot different than what she had initially. So the picture on the left is obviously when she presented with her broken tooth. The picture on the right is after we've put a provisional in place, something to just get her presentable until we could determine what it was she was wanting to do. So communication tools that we used, pictures of smiles that you like. So these are examples of some of the pictures that I sent her. And you can see whenever you're looking at the front teeth versus the two front teeth are called centrals. The two teeth to either side of the centrals are called laterals. And you have a lot of options here. You can make those slightly shorter. You can make those slightly narrower. You can have the edges be flatter. You can have the edges be rounder. Those are all things that can be completely customizable. You typically want to have certain proportions seen between the centrals and the laterals, but there can be a little, anything can be customized at this point. You can also see on the image on the lower right how the teeth kind of taper more towards the gums, where on the image on the lower left, They're a little bit more at the base of the tooth towards the gums. They're almost as wide as they are towards the chewing surface. So again, those are all things that we look at, and those were all things that we discussed to get her smile design like she wanted it. So another communication tool that we didn't use with this particular patient, but that can still be quite helpful is models with wax templates. In a dental office, this is typically called the wax up. Now, in this particular patient, she is missing a front tooth as well as a tooth to the side. Now, she's only missing one front tooth, but that is still a pretty big space that we're trying to close. We don't want to have one single tooth that's that big fill the space. That's not going to look natural. So to be able to get our symmetry right and see what the shape is that we can accomplish and be able to give the patient a preview of that, we completed a wax up, and you can see that on the right side, and you can see we were able to get things lined up a little bit better. The orientation of the teeth, they're a little bit more, they're not flared out as much. We're able to kind of straighten them up, so we were able to reduce her overbite and her overjet somewhat. The overjet is how far forward the teeth come. The overbite is how much the teeth overlap when they close. And we were able to give the patient again a preview of what that would look like. And for a case like that, a wax up is probably the most helpful thing, because you base it, you still have to look at what teeth are there to support our restorations and dental work, and what space constraints are we going to be working with. And the wax up is one of the best ways to visualize those changes and be able to convey that to a patient. So next we have provisionals. Those can be temporary crowns, that can be provisional veneers. In this particular case, what we did was we just reshaped the crowns that she had, because at that point she had made the decision, I do want to whiten my teeth, I do want to change the shape of my teeth, and there was no sense in us taking off her permanent crowns just to put provisionals on. Just so we could see the shape differences. We just reshaped her crowns, and you can see we narrowed them somewhat as they go towards the gum line. We also softened the edges where they're not so bulky, they're not so flat and straight across, and we were able to contour that. And there was a few minor changes that I think she wanted. She liked the lateral on the left side, how that was rounded just a little bit more than the lateral on the right side. So there were a few little notes that we sent to the lab whenever we completed her finals, so that she could get the end result that she wanted. Now, also, whenever you look at that, you can tell where I've reshaped those crowns. Crowns naturally have a nice glaze, a nice shiny luster, and you can see by us adjusting her permanent crowns that she did not like, we still lost a little bit of that luster, but we were able to gain the knowledge of this is the direction that she wanted to go. So it was well worth it for her. So the next would be digitally enhanced photos, and these are just basically using cosmetic imaging to alter the picture, and this can really give patients the preview of what is possible. And that can be a nice addition, whether you're looking at what changes would I see just by whitening, or this patient obviously has a lot of wear on teeth and the smile line is a little bit uneven. And so what if we lengthen those teeth back to what they used to be and whitened as well, and you can see the uniformity that's gained from that. And so all of those can be valuable tools in communicating with patients, and for patients to communicate with me what they want out of their smile makeover. So again, here we are. We've talked about our patient with the broken tooth. So there she is on the upper left with her broken tooth. Upper right is where the provisional is in place, and basically we are just trying to get her presentable at this point and let her think about what options she wants to do. Lower left is where we have recontoured her crowns to a shape that she felt was more reflective of what she used to look like. And then after whitening, obviously crowns do not change color with whitening, so we had to remake the crowns in a lighter shade, and that's our end result on that lower right. Overall, she was very pleased, and that's something that we strive for with all of our patients, but for this patient in particular, she admitted that when she had the reconstruction done several years ago, that she felt that it was rushed and she wasn't able to give the appropriate feedback. And through the communication that we did with her through pictures and through recontouring her existing crowns, she really felt like she was involved in the process. She really felt that I was able to give her what she wanted, even though at first she wasn't able to articulate exactly what that was. And so, in a sense, we helped her find her voice so that she could really get the most out of the experience, and it was more rewarding for her, and it was something that she was certainly very glad that she did, and very happy with the end result. So, I'm Dr. Kristin Rushing. Thank you for tuning in today and talking about communication tools to be able to design your smile makeover. Thank you very much. Bye.